Which of the following is true regarding pediatric ECG analysis? A. Left axis deviation is normal in healthy neonates. B. Atrial fibrillation is the most common pediatric dysrhythmia. C. T-wave inversion in the anterior precordial leads, V1, V3, is a normal finding in school-aged children. D. Cardiac dysrhythmias are the most common electrocardiographic manifestation of underlying congenital heart disease. E. ST elevation is most commonly associated with myocardial injury. Answer is C. T-wave inversion in the anterior precordial leads, V1, V3, is a normal finding in school-aged children. T-wave examination has limited utility in pediatric EKG analysis. Upright T-waves in the anterior precordial leads, V1, V3, are normal in the neonate, but they invert after the first week of life and remain inverted until early adolescence, at which time they take on the typical adult, upright appearance. In some patients, the juvenile pattern of T-wave inversion can persist into a patient's 20s. In contrast, upright T-waves in the anterior precordial leads of an otherwise healthy child can be a sign of right ventricular hypertrophy, RVH, which may reflect underlying congenital heart disease. Right axis deviation is a normal finding in healthy neonates due to the large right ventricular mass, but this resolves over time. Left axis deviation is not normally seen. Supraventricular tachycardias are the most common dysrhythmias in pediatric patients. Atrial fibrillation and atrial flutter are rare and are typically only seen in post-surgical patients after congenital heart disease repair. In general, rhythm disturbances are uncommon presenting manifestations of congenital heart disease. Ventricular hypertrophy and axis deviation are common indications of underlying structural heart disease. ST elevation in otherwise healthy children and adolescents is usually due to BER. However, as in adults, ST elevation can indicate myocardial infarction. Since myocardial infarction is exceedingly rare in the pediatric population, other findings supporting a diagnosis of infarction should be sought, such as cardiac enzymes.